I'm Tim Amrine. I'm a neuroradiologist here at Duke University Medical Center, and I specialize in spine intervention, and in particular in the treatment of patients with CSF leaks and CSF pressure pathologies and spontaneous intracranial hypotension. Patients with spontaneous intracranial hypotension or CSF leaks present with a whole bunch of different symptoms. Most commonly, they present with orthostatic headaches, which are headaches that are better when laying down and worse when standing up. In addition to this, though, they can have a bunch of different other symptoms that are related to the cranial nerves, which includes double vision, loss of vision, loss of hearing, ringing in the ears, changes in taste, sometimes dysautonomias where there's changes in heart rate or blood pressure. And because of this, it's a really difficult diagnosis to make and one that's often missed. These patients often suffer considerably secondary to the symptoms, but there is a treatment, and that's blood patching. Since spontaneous intracranial hypotension is such an underdiagnosed condition and poorly known about, a lot of research still needs to be done. And in particular, we need more research on how to diagnose the condition, find the causative CSF to venous fistulas and CSF leaks that we know cause the condition, and learn better how to treat these patients. Part of our research efforts here at Duke include the initiation of the first ever prospective randomized clinical trial examining the efficacy of targeted blood and fibrin glue patching. This is the PATCH trial. The PATCH trial is designed such that we take patients who have known spontaneous intracranial hypotension and, importantly, a defined and clear CSF leak on imaging, such as a CT myelogram, and we randomize them into one of two treatment arms. One treatment arm, the patients receive the optimal therapy that we have today, CT fluoroscopy-guided patching with both blood and fibrin glue. In the other treatment arm, patients receive a simulated procedure. This is a really important trial because the goal, of course, is to prove that patching works and to confirm that this is the best course of action for patients with this condition around the country and around the world. For this first critically important trial, we need to enroll patients who have a confirmed and definite CSF leak that we can see on spinal imaging. So unfortunately, this doesn't include patients where we suspect that they have a CSF leak on imaging, or even patients that we know have spontaneous intracranial hypotension, but we can't find the CSF leak. We first need to confirm that patching works by examining patients where we can definitively find the source of the leak. This trial will form the basis for even bigger trials in the future where we examine some other important questions as to whether or not targeted patching versus non-targeting patching is optimal, and even whether or not the addition of fibrin glue is helpful in treating patients with CSF leaks.